Well, for more on the hunger crisis affecting Gaza, let's bring in Dr. Ahmad Al-Fara. He's the director of the Maternity and Paediatrics Department at Nasser Hospital in Gaza and joins us live now from Khan Yunis. Thank you very much for your time. First of all, now we've spoken to you on numerous occasions about the hunger crisis in Gaza. Just how bad is it now?
Thank you for having me, my friend. This is a great honor to be one of the speakers for your TV channel. Again, about the malnutrition situation in Gaza, it's like ice ball, increasing size day by day. You know, the last statistic in the Ministry of Health in Gaza, they are talking about nearly 70 cases have been died from malnutrition. They are talking about 700,000 child under the line of malnutrition. It is something you can't imagine and you can't describe the situation. Today, my friend, I have my daily round on the patient on the malnutrition department in Nasser Medical Complex. I saw a little girl which is 7 years old. Her name is Rahaf. Her age is 7 years. She has to be nearly 20 kilos. She weighed 20 kilograms before the malnutrition started. Now she's just 10 kilos. She lost 15% of her weight. She was in a very desirable condition. She was depressed. She was unable to talk or walk. She's lost the subcutaneous fat. She lost the muscles, just skin over the bone. My colleague, I want to make attention that we studied the diseases of malnutrition in medicine since 25 years ago. We thought that it is something about theory to study this, and our teachers and our seniors told us that this is for a history of medicine. You will not see these diseases about hypovitaminosis, about rickets, about scurvy, about severe anemia, about marasmus and kwashiorkor and severe acute malnutrition. Nowadays, I swear to God, every day I'm facing, and I found a lot of cases that are aggressive examples for severe malnutrition. In fact, the distribution aid that Israeli leaders talking about, this is a smoke, this is a trip, this is like a trick. If you can imagine that they allow to some people to come for a camp. This camp, they putting the aid on the tables, and suddenly they allow them to get inside. Everyone is get more faster to take, and they are enjoying that what's happening. And some snipers, which are very skilled snipers, are enjoying shooting that adolescent and that younger people by targeting them sometimes in the eye, sometimes in the mouth. I saw a lot of cases in the reception room in Nasser Medical Complex. Every day we receive nearly 20 to 30 cases targeted. They were there to feed their family, to feed their father or mother or sister or brother, and they come back as a bodies. This is very, very catastrophic and disastrous story. Yes, please.
Dr. Al-Fara, I did want to ask you, if Israel as it claims, is controlling the entry of aid through these Gaza Humanitarian Foundation aid distribution centers, as they say they are, in order to stop Hamas from getting their hands on any of this aid, why then are they stopping the entry of this much-needed baby formula? Children, yet again, babies, bearing the brunt of this war. Why baby formula?
Please, my colleague, I want to mention that the Israeli leaders always mislead the world and always make this as a trick that Hamas will get that aid. We always listen about that scenario and they repeat that scenario. This aids will go to the Palestinian people. There is a logical channels like the United Nations, UNRWA, like the UNFPA, like UNICEF. They are dealing with the Palestinian people as human beings, not like animals. Sorry for expression. They have the civilian records. They have the identity card for Dr. Ahmad, for example. They send a message for his phone. Please go to the place at that appointment to get your package for your family. You are going with a humanitarian way, a moral way, not to go by this way. I am a doctor. I can't send my son or my daughter to go to that area to be killed. Unbelievable. I will not go. My age is not allowed for me to run and to make a race to get that package. Again, they have to know you are dealing with a human being created by God. They have the right to eat. They have right to be fed. They have right to drink. They have the right to educate and learn. They have the right to receive the medical and health supplies and health services. They have the right to travel, to go out Gaza and to come back to Gaza. This is rights what are all the world talking about. So again, what's happening is unbelievable. According to the milk, my colleague, you can imagine in my neonatal ICU today, I have nearly 20 babies. 15 of them, they are premature babies. They just depend on the premature formula. We have lack of premature formula and also the normal formula. My ask and my question for this world, what is the crime that this baby have done to be punished and to be targeted by hunger, by thirsty, by not allowing the milk for them? You know, the milk is the only source of energy for them. They can't take a breastfeed because they are premature babies. They just kept in the neonatal ICU for just feeding for that milk, and that milk is not available now. What we can do for them? If they lost the energy, the source of energy, they will regress. They will get in metabolism shut down. They will get in electrolyte imbalance. They will get in infection, and then we lose them, and they will be expired. It is unbelievable. Unbelievable to talk about that.
It is very tragic to listen to your details of what you're witnessing on a daily basis. We really appreciate you speaking to us here at TRT World. Thank you very much, Dr. Ahmad Al-Fara, speaking to us live there from Khan Yunis in Gaza.
Thank you, my colleague. Thank you.